USMLE style question on anemia of chronic disease. A 65-year-old man with a history of rheumatoid arthritis presents to the clinic with fatigue and pallor. He has been experiencing increased joint pain and stiffness over the past few months. Laboratory results are as follows. Hemoglobin, 10.2 gram, normal 17.5 gram per d. Mean corpuscular volume, MCV, 78 Fillers, normal 80 to 100 Filler. Serum iron, decreased. Total iron binding capacity, ABC, decreased. Ferritin, increased. Transferrin saturation, decreased. Which of the following best explains the pathophysiology of this patient's anemia? A. Autoimmune destruction of gastric parietal cells leading to vitamin B12 deficiency. B. Increased hepcidin levels inhibiting iron release from macrophages and decreasing gut iron absorption. C. Defective hemoglobin production due to abnormal globin chain synthesis. D. Inhibition of ferrochelatase and ALA dehydratase leading to impaired heme synthesis. E. Chronic blood loss leading to iron depletion. Answer B. Increased hepcidin levels inhibiting iron release from macrophages and decreasing gut iron absorption. Explanation. This patient has anemia of chronic disease, ACD, a common cause of normocytic or microcytic anemia in patients with chronic inflammatory conditions, e.g., rheumatoid arthritis, chronic infections, malignancies. Key mechanism: chronic inflammation leads to an increase in hepcidin, an acute phase reactant produced by the liver. Hepcidin inhibits ferroportin, reducing iron transport from macrophages and decreasing iron absorption in the gut. This leads to iron sequestration in macrophages, reducing iron availability for erythropoiesis. Characteristic lab findings: serum iron is trapped in macrophages. TABC, iron is not circulating, so there is no need for transferrin increase. Ferritin, an acute phase reactant that increases with inflammation. Transferrin saturation, less iron is available for RBC production. Why other options are incorrect? Option A, autoimmune destruction of gastric parietal cells leading to vitamin B12 deficiency. This describes pernicious anemia, which presents with macrocytosis, high MCV, hypersegmented neutrophils, and neurologic symptoms. Option C, defective hemoglobin production due to abnormal globin chain synthesis. This describes thalassemia, which presents with target cells, microcytosis, and an increased RBC count despite anemia. Option D, inhibition of ferrochelatase and ALA dehydratase leading to impaired heme synthesis. This describes lead poisoning, which presents with basophilic stippling and increased protoporphyrin levels. Option E, chronic blood loss leading to iron depletion. This describes iron deficiency anemia, which presents with low ferritin, high TIBC, and low transferrin saturation, opposite of ACD. Thus, the correct answer is B. Increased hepcidin levels, inhibiting iron release from macrophages, and decreasing gut iron absorption.